Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Good evening, everyone, and welcome to a fresh episode of ATP Hour. And today, I'm not going to be alone on this program. I have a very important specialist who is going to be talking to us about this important topic of cancer in children. I know some of you wondered, really, do children have cancer? And so, because it's something so important, we've decided to bring in a specialist. So, let me show you my guest. I want to welcome Dr. Ololade to our broadcast. Dr. Kehinde Ololade, you're welcome to ATP Live, ATP Hour. How are you today?
Thank you very much. I'm happy to be here. Thank you.
All right. Um, just a little bit of introduction. Dr. Kehinde Ololade is a radiation oncologist. So for those of you who may not know, these are doctors that specialize in treating cancers. And he did his undergraduate studies at the University of Lagos and then residency also at the Lagos University Teaching Hospital before going to South Africa to do subspecialty training again in radiation oncology. So he's super specialist, and he's currently a lecturer at the University of Lagos and also run his own practice at Jacaranda Cancer Center in Abeokuta. And so we're so blessed to have him with us today to answer your questions, because you can always ask Dr. Bimi question on cancer, but I've brought the expert today to talk to you. All right, so thank you, Dr. Ololade, for joining us. I just remind us that this program is brought to you by Ask the Pediatricians Foundation. We're committed to the health and the welfare of your children. And on ATP Hour, we do talk about important topics that have to do with the health of our children. And I decided that today I will bring a special guest who will be talking to us. But if you want to watch these past episodes, you can always watch on our all our platforms, on Instagram Live, on YouTube, on our Facebook page, on Ask Dr. Bami ATP podcast. So whichever platform, or for those of you listening on the radio, Fresh Waves Radio. So thank you so much also for joining us today. And if you have any questions, remember you can post on our Facebook groups, and our professionals will be there to answer your questions. So, but I already know the kind of question you would like to ask the specialist today, so I will start asking him. And at the end of the day, if you still have any more questions, don't forget to send it to us, and we'll pass it across to him and then get back to you as well. So thank you, Dr. Ololade, for joining us today. We're going to be talking about childhood cancers. The first thing I want to ask you, is it possible, do children have cancer? Is it something that happens in children, or is it just adults issue? What do you want to tell us about that? Thank you.
Well, thank you very much for having me. Cancers are no respecter of ages. Cancers could occur in the children as little as 6 months to a year, to those that are toddlers. It can also be seen among school children, even up to the age of teenagers and all that. So, I mean, there are various kinds of cancers that are very common in children, particularly the kinds of blood cancers, the others that have to do with the eye, like retinoblastoma, the others that have to do with the kidney, the Wilms tumor, and nephroblastoma. And also, there are also others that we call the nephroblastoma that could happen from the adrenal glands and all that. So so cancers do occur in children. It could they actually belong to a family called the round blue cell tumors, which are very common among children. So so those ones are pretty common among children. So so we have most cancers among children. The common cancers in the adults, like breast, prostate, and cervical, do not occur in children because those are organs of the body that actually grow or mature following puberty, when a child goes into secondary hormones are secreted to facilitate such growth. But at the level of the child, where the child is actually just growing, some rapidly growing tumors could refuse to obey the instructions from the body. And whenever those cells refuse to obey the instructions from the body to limit their growth, for example, a cell from in the kidneys that is supposed to grow only 200 times and refuses to stop when it gets to 200 and continues to grow up to the level of 10,000 times, we'll say that kind of cell has undergone what we call the malignant transformation. Also, one other feature is that when you see that those cells, for example, if they're supposed to be only be limited to the organ of the kidney, then they spread from there and they go from there to other organs, like to the lungs, to the bones, to other parts of the body, what we call spread or metastasis. In that case, then you know that a cancerous process has taken place. Another thing you will see is that normally when cells grow, they don't invade or they don't attack organs that are attached, that are closely linked or limited to them. But in cancer cases, you'll see that they invade adjoining organs. So when you see such cells, for example, if you have a neuroblastoma, it could invade the surrounding vessels, it could invade the surrounding organs, it could invade the skin, it could invade the GI system. Such also invasion is another characteristic of the cancer cells. Another thing is that because they refuse to follow the normal trend of their breakdown and their growth, they undergo what we call the rapid division. Because of that rapid division, their cells and the cell walls become very, very friable. When it becomes very friable, then what we realize is that they are easily prone to bleeding from those organs. And they could have, for example, if it's a nephroblastoma, they could be bleeding into the urethra, such that the child will be seeing blood within the urine. So a few things like that could help us understand that it could also happen in children.
All right. Thank you so much, Dr. Olade. I know you really went ahead and explained more to us. So I think what our specialists have told us now is that cancers can happen in children, but it's maybe different kind of cancers to what we normally see in adults. But children also have cancers. And Dr. Olade has also told us all the things that you will see that will help us to know that this is just not ordinary growth, but cancer. Now, you were mentioning quite a lot of some names, and I know they were sounding so big. I just wanted to help us break it down. So, can you tell us when you say these names, what part of the body is this cancer occurring? So, you mentioned neuroblastoma, nephroblastoma, blood cancer. Can you just help us? Just tell us the name of the cancer and which part of the body so that parents know these various kind of cancers that happen in children and the parts of the body that tends to be affected. Thank you.
So when we have things like um, meningioma, that affects the brain and the brain organ. When you have things like nephroblastoma, that affects the kidneys. When you hear things like retinoblastoma, it comes from the retina. Normally, when cancers occur in children, they use blastoma to demonstrate or to color the organ. So we have retinal. Retinal is from the retina of the eye, and we have blast, which is the cancer process going on. So we call it retinoblastoma. Whereas in neuroblastoma is when they originate from the adrenal gland in the children. So, when you have leukemias and all that, those are from cancers that occur within the blood cell lines. So essentially, those are the very common ones that we'll see in children.
Okay, thank you, sir. And I want to now ask, what are those things that parents, we as pediatricians, we always want parents to pick up things early and we want them to come to us. So, what are the symptoms, common symptoms that parents will see in their children that will make them suspect, that this child may have cancer, and so that they will now know when to come to seek for help? Can you tell us things that parents should be
Excellent.
watching out for? Thank you.
Yes. One of the things is that if you have a child and you notice that when you look at the child, there's something that looks like the eye of the cat eye reflex, then you can suspect that the child needs to be assessed for retinoblastoma. When the child is being cared for, particularly when they're taking bath for the child, it's always very important for the parent to be aware of the unique features of the child. Does the child have a big tummy? Is the tummy increasing in size? Do you notice that one side of the tummy is just big? Is there anything like hard, like stone in the tummy? Do you notice that are there signs of like a vein on the tummy that shows that the tummy is under pressure? I mean, that's also a sign that there's a lesion or there's a tumor within the tummy. Also, if you notice that the child suddenly is having fever that is continuous, has been treated for infection, has been treated for malaria, and the fever is continuous, coupled with the fever, and the child is having passage of blood in the urine, then we should be mindful and the child might need further evaluation. If you notice that for one reason or the other, the child is having bruises, and the bruises, there's a lot of, maybe the child went to play football and hit the leg against something, and the place gets swollen. And when they do a chap of it, they realize that it's blood that is in hematorosis. Then the child is at risk of things like osteosarcomas and all that. So if you are able to domicile that. Also, if for one reason or the other you notice that the child is coughing and the cough, there's blood in the cough, then, or the child is having what we call difficulty with coughing, with breathing, or respiratory embarrassment, as it's called in medical terms, then that child needs further evaluation. Thank you.
All right. Thank you, Dr. Lolade. So, what I can get from that is that some of the signs that we see in cancers could also be the same signs we see for other common conditions. But, like you said, like if a fever is going on for too long and the child is having infection, because we do get a lot of these questions on ATP, and mother will say, we've treated malaria, my child is always having fever every month, and the child is always having, this. And some people say, my baby's tummy is so big, and they want us to tell them what to do. So, what the doctors is saying that the cancer signs also may be similar to some of those signs, and this is why we do emphasize the need for us to go to the hospital and not always assume everything is malaria, especially if you are treating your malaria every week, every month. You may need to make sure that the doctors also see our children so that we're sure. Okay, so if we see the signs that are taking so long and they seem not to be going away, what should parents do in terms of how do we go about getting our children diagnosed of cancers, and then later we can talk about the treatment. But let's first talk about how do we get the children to how do we know that these children have cancer after suspecting the symptoms and we've gone to the hospital? What do you do as the oncologist to arrive at the diagnosis? Thank you.
Well, in order to make a conclusion that a child has cancer. Cancer diagnosis is not a child's play. It's a major diagnosis. Because it's a major diagnosis, it's a life-changing diagnosis that um, um, affects not just the patient, affects the caregiver, affects the parents and all that. In order for us to make up that kind of decision, we have a few set of the groups or categories of investigations that will be done. There's the tissue investigation, there is the hematological investigation or the blood investigations, and there's what we call the radiologic investigation. Now, the first thing we will do is that I want to check the blood. Are there other things in the blood? There's some things we call the tumor markers, which will be elevated if a child is having things that have to do with that has to do with the cancer that 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 particular tumors. And also, we notice that when we check the blood, we realize that the child is not having malaria. The child will not be having any form of infection, but we will notice that persistently the child's blood is getting low, getting low. There will be a lot of pallor in it. Also, if the disease or the cancer affects the kidneys, then we will observe that the child will have a deranged or an abnormal renal or what we call the kidney function test. The child may have elevated creatinine, may have elevated, there's some electrolytes or there's some materials that are in the nucleus of the cells. When they break down rapidly because of fast multiplication, they release some of those things into the blood. So when we do those tests, when we do the liver function test, when we do the electrolyte and urea, we will see some of those urea, particularly things like uric acid, they will be elevated within the blood system. Also, apart from that, when we also check for the we'll check what we would have checked for infections. Then from the hematological test, which is a blood test, we now do what we call the radiology test. It starts from things as simple as an ultrasound scan. Ultrasound scan will give us an idea of the size, will give us an idea of the involved tissues, will give us an idea of what can be done to the different areas. It will tell us whether the thing is just local or the thing has gone and is at risk of being invasive. We can have that ultrasound scan done that will tell us of the size. And we can also have the CT scan of the chest or CT scan of the abdomen done. Those ones are called staging or staging image radiologic examination. That will tell us the extent of involvement. It will tell us, has it involved the liver? Has it involved the lungs? Is it restricted only to the kidneys in nephroblastoma? Does it have any other part of the body? Has it involved the bones? Has it involved the brain? It will tell us. And with that, we'll be able to use that to manage the expectations of the patient, manage the expectations of the caregiver, plan our treatment protocol, and also know that whether we're just going to go in and do a surgery to get the lesion removed, or whether we're going to have other treatments that are going to be systemic, that will not just involve only the primary side of the disease, but will also involve other parts of the body. So after that has been done, then once we are able to characterize that, if it's early, then we will need what we call a tissue diagnosis. In some cases, they will do the surgery, then they'll send the tissue to the histology lab to show whether it is malignant or it is benign, or it is whether it's cancer or not. Whereas in other clients or in other situations where it's it's a very large and it has spread to other parts, to confirm, we just take a little tissue and send to the lab just to confirm the diagnosis that is involved. Also, there's some people that unfortunately they have lesions in areas that are not readily accessible to surgery. So we use only things like CT and MRI to make their diagnosis, like the pineal gland tumors.
All right. Thank you so much, Dr. Lalade. So from what you're saying, you've already told us that cancer there can be different kind of severity of the cancer. So you're saying that some could be early. So can you expatiate more on that, just to
Yes.
clarify?
So normally one of the benefits of being very um, close and aware of the body of the child is that it will help you to quickly notice if there are changes in the way of in the build of the body of the child. If there are changes in the organs, you will notice. If there are changes in the features in the eye, you will notice. Now, most lesions they start from stage 0, stage 1, 2, 3, and 4. Stage 1 and 2, most of the time they are early and they are amenable to either complete excision, surgeries, and all that. But once they get to stage 3, involves sensitive organs. Stage 4, when it has spread to more organs than one, then in that case, then you know that all you can do is to give systemic therapy and to manage the limited expectations of the patient. So for early cases, they are likely to have complete treatment, complete recovery, complete back to normal lifestyle. Whereas for those that are late, they have very poor and very limited chances at survival. Thank you.
All right, thank you so much. So, which brings me to the next question of, is cancer curable? Because I think that's what question that parents want to ask us as pediatrician after we've confirmed that this child actually have cancer. Is there hope, or is it always like an hopeless situation? What will you say when it comes to, let's focus now on childhood cancer specifically? Did you get the question, sir? Yes. Did you get the question? So is cancer curable? Is there hope, or is it an hopeless situation? Okay, I think I'm having some breakdown with technology with my guest on the show. But just to let us know, Dr. Lolade is a radiation oncologist, and he has been talking to us about cancers in children. And he has told us that cancers can occur in children, and it is not just an adult issue. Children can have cancers, and most of the childhood cancers tends to end with the word blastoma. And he has taught us that these cancers can involve different parts of the body. And now he has also told us that about how the specialists do make diagnosis of cancer in children, including doing blood tests, including doing radiology tests like scans or CT scan or MRI and all that, and including doing things like uh, um, all that what we call tissue diagnosis, like taking a little bit of the part of the body affected, and then they can now decide what is actually going on. And just before we had this little break, it's about talking about the different types of cancers, and that cancers in terms of the severity, if you pick it up in the early stage 0, 1, 2, that is early, and those are usually easier to treat. And then when we pick it up late, that is stage 3 to 4, those are the more severe kind of cancers, and those ones are much more difficult um, to trace. So I was hoping for Dr. Olade to tell us about is cancer curable. So I hope you'll be able to still join the rest of the broadcast and answer those questions that you may have. But one thing that our doctor has really emphasized for us today, especially as parents, is that some of the signs of cancers are also the kind of signs we see for common condition, the fever, the child looking pale, the child losing weight, or the child's, or maybe some part of the organ, maybe the abdomen getting swollen. So let's not always assume everything is malaria or infection, and which is why we emphasize that if a child has these symptoms and you've done your own usual, maybe you give them paracetamol, or you even go ahead and give them anti-malaria, and they're not getting better, we really need to um, we really need to make sure that we give them, we take them to the hospital, and that way the children can get the right um, treatment. Okay, so that is how uh, cancers are usually diagnosed. This is when we see that this condition has been going on for too long, and then doctors want to do investigation. This is why it's so important that we take children to the hospital. When we take children to the hospital, doctors can do appropriate investigations, and it is not all the time that it's only full block and malaria parasite we're looking for. Sometimes we're doing investigations and looking for something that is not as serious. Okay, Dr. Lolade, you're back. Thank you
Yes.
so much. I think we have some technology breakdown. All right. So I was going to ask you when you were away, I was just summarizing what you've said so far. So I was asking you, is cancer curable? Or is it like an hopeless and death sentence? What will you say to our parents about
Well,
that?
that answer is dependent on the stage.
Mm,
Whenever the first stages in cancer, one of the stages, the last stage, stage 4, is where the hope is going to be dim. But is cancer management and cancer prognosis and cancer outcomes is dependent on a trajectory from a best case scenario when it's stage 1, stage 2, and to a worst case scenario when you have a stage 3, stage 4. And people body systems are also different, and the caliber and the quality of treatment they're exposed to will also go a long way to demonstrate the possible outcomes that they are going to have. Majority of those that are treated by qualified colleagues and they present quite early, they do very well. However, a lot of people that spend the period where they initially make the diagnosis, going from one herbal home to another, going from one spiritual or religious house to another, and not actually using that to complement the the treatment that's offered them, will be at the mercy of the extent of capability of the system. It's just a matter of time before the system, the immunity of the system, the blood, the effects, and all that get overwhelming, and they succumb to the disease. So, in order not to follow that trajectory of it being a death sentence, we always encourage our people that when you notice something, they should say something to their husbands, to their wife, and also to their parents, and also ensure that they seek for help within the right quarters. I mean, you understand, there are so many areas, so many support groups, so many individuals, like the Ask the Pediatrician Foundation, who's doing a wonderful job ensuring that as much as possible, people from remote areas in the world where they don't even have access to treatment, but they have access to their phones, can get on their phones, ask questions, set up meetings, show images of what they see in their children, and if they need be, get appropriate advice and treatment in that regard.
okay, thank you. So the emphasis is early detection. So what we're saying is that if we pick up these things early, if we notice the signs and we go to the hospital early and our doctors are able to make the right diagnosis early, it can be cured. But if we come late or we've wasted too much time, then that is actually more difficult. All right, thank you. So how do you treat cancer? I mean, what is the treatment available for cancers in children? Do you want to tell
Well,
us?
yes, thank you very much. There are three major treatment patterns for cancers in children. The very first one is to get the tumor out. If you present early, there's a high chance that surgery will be your first bet. Now, surgery means the tumor is malignant. We want to get rid of the tumor by removing it in the theater. The second one is the use of chemotherapy, where we inject some drugs that are tailored to the weight, to the age, and to the size of the patient via the body surface area to get rid of the tumor. Also, in certain cases, we make use of ionizing radiation by exposing that area that is involved to radiotherapy to the radiotherapy machine such that it treats the disease and prevents it from recurring. If it has to do with blood cancers, for example, there are things like transplanting of the bone marrow transplant and things like that. So essentially, I mean, the treatment sits on the pillars of surgery, removal of the disease, of chemo, giving injections that are tailored towards the age, the weight, and the size of the patient, and also radiotherapy, the use of ionized radiation via the radiotherapy machine linear accelerator presently, I mean, where it involves the use of the ionized radiation following the mapping of the disease to one particular area of the body and sparing other organs that are clean and not involved in the disease, and also the use of other transplantings like the bone marrow transplant.
All right. Thank you, sir. So I want to ask, so is there any hospital that we can just walk into for this kind of treatment, or are there specialized centers when it comes to cancers in children?
When it comes to cancers in children, one of the things that the if you present to your general practitioner or the medical officer at or the nearby primary health care center, they most often than not, they will direct you to the secondary care level. When the secondary care level has been able to do the much they can do, probably surgery, and then they will now refer you to an area where what all they do is cancers. And the rationale is very simple. You know, what an individual does, the kind of treatment it does regularly, is likely to be very proficient in doing it other than that being done by another individual that does so many things. You know, there's this English saying that says, "Jack of all trade, master of none." But when you get to come in contact with someone that does only cancer care, they know the side effects they're likely to encounter. They know the caliber of patients. They know the patients that are likely to respond very well and those that are not likely to respond very well to the treatment. They know the things that are supposed to be done to ensure that as much as possible the side effects are well managed. The way chemotherapy, for example, will fluster a general practitioner is like the gun in the hand of a marine that knows how to be pointed at it, unlike the gun in the hand of someone that is an amateur and doesn't know about the use. So we always encourage people that they go to the health center. The health center will tell them where they are likely to have the appropriate individual that will make the care and the treatment. Thank you.
All right, thank you. So how cheap or how expensive is cancer treatment? Do we need to sell our house or sell our proverbial kidney to treat cancer in children? What will you say to that? Because I think that's one question most parents want to ask.
Well, environments are different. What we are advocating for is a situation where people are involved in health insurance, and the health insurance takes care of any unforeseen circumstances. Because the truth is that cancer care is not cheap. And it's not cheap in Nigeria. It's not cheap anywhere in the world. I mean, I was in a meeting today, and in that meeting, one of the things that came up was that Nigeria was the location with the cheapest of where the company sells the cheapest of their drugs. Whereas the drug was around 900 here, it was about 3,000 in Europe and about 6,000 in the United Kingdom, and even a little bit more in the United States of America. So all over the world, cancer care is not cheap. Radiotherapy, for example, in the US is $45,000, whereas in Nigeria it's about 1.5 million. So, you know, but we advocate that people that present early, the good thing about presenting early is that the cost of cancer care increases as the stage of the cancer increases. So those that present early, that have to only do surgery and probably chemo, they are not like those that have to do chemo, radio, they now have pains, and they're now taking blood transfusion every now and then. They're now in and out of hospital. In every hospital visit, they will have to pay for admission. they pay for professional fees, nursing care. They're not going back and forth. And they can also continue their life, continue their schooling, continue their playing, continue their games and all that when they present early. But those that present late, they present in a moribund, some of them present in a moribund situation, such that we can only manage them ahead of the inevitable.
Mm, Thank you so much. Again, the emphasis on early presentation. Early presentation, the child is likely going to get treatment and be free from cancer, and the child is also likely going to get treatment that is not as expensive, like if we come in late, and also quality of life is much better. So in terms of I know some parents would like to know, are there like NGOs? I know we don't do that in ATP. We don't sponsor cancer treatment like Dr. Olade said. Cancer treatment is so expensive anywhere in the world. But I don't know whether, Dr. Olade, you have organizations that are non-profits that parents can go to. Like we have for cardiac, we have Kanu Work or Heart Foundation. They support hearts surgical repair for congenital heart disease. I don't know. Is there anything like that for cancers? Maybe.
Yes, there's the Dorcas Foundation, the
Okay.
Dorcas Children Cancer Foundation.
Oh,
Then there's also another one in UCH.
okay.
Dr. Sarimi, they have there are two that I know very
Yeah.
well.
And I know
Let
there's
me see
one in
whether I can.
Luz. Yeah, I know there's one in Luz. Dr. Ngwobi does
Then
child.
there's also the one from Dr. Obi. Then there's the one from Dr. Obi. There's the one from Dr. Sarimi at UCH. There's one from Dr. Joseph also in Luz. So so there are a few of them here and there. You understand? I mean, the
So,
approach is just to search for it, and
mm,
they could definitely
uh,
find um, children cancer support groups and all that.
yeah. All right. So maybe after the program, we'll try and put up a list of some of these foundations. So for those of us who think I would love my child to be treated, but I don't have the money, just for you to know that there are a few non-profit organizations that will be able to support us. Okay, so today we're just going to end this program by using a common example of childhood cancer. We're going to talk about what we call nephroblastoma. So we use this nephroblastoma as a case sample of how cancer can present in children and from diagnosis to treatment. So let's start by asking the lady, what is nephroblastoma? Can you tell us what?
So
Can you,
nephroblastoma is a tumor that occurs in the kidney of the child.
yeah. So is it usually one kidney or both kidneys or
Normally
how?
it's one kidney, but some people, unfortunately, the two kidneys will be involved. And another name for nephroblastoma is Wilms tumor. So when they say
Wins?
Wilms tumor, they're referring to the same thing. When they say nephroblastoma, they're referring to the same thing.
Okay, wins tumor. So it's one of the most common of those childhood
It's the
cancers.
commonest of the abdominal tumors. And it's commonest among the abdominal tumors. And
Yeah. Okay. So how do parents pick up that my child may be having nephroblastoma or Wilms tumor? What are the early signs that we will say?
well, unfortunately, because the kidney is a retroperitoneal organ, the early sign, the commonest sign, which is about 80% cases, it's asymptomatic. That means that it's not going to show any sign. By the time it's showing a sign, most often than not, it's often advanced. However, for caregivers that are very diligent and dutiful, they will
Mm,
notice that the child has a swelling in one part of the abdomen while giving care. And the child will not have any pain, but there'll just be a painless swelling. So, so those are the early signs. And there's something going on in this tummy. This tummy is not as it used to be. Some
mm,
other cases will have passage of urine that is bloody. Some people will have continuous fever. Yes.
mm. Yeah. So please, parents, when we see our baby's tummy being bigger than normal, Don't just say, oh, it is because he's eating too much. And some of you do show us pictures of this big tummy in 2 year olds, in 3 year olds, and you just think, I always tell you, you have to take the children to the hospital, because the only way we will know what is swallowing that tummy. Sometimes it is just gas, yes, thank God, but sometimes it could be Wilms tumor, it could be something. The kidney that is getting bigger, and the child is otherwise, initially well. So please, when the child's tummy is big, let's not assume it is just food or gas. Let's take them only doctor touching the tummy, and we can know which of the multiple organs in that tummy is swollen. So which age group tends to have this Wilms tumor, Dr. Lalade? Which age
It's
group?
common between the age of 2 and 5. Some will say between 2 and 7. But the
Okay.
commonest age is 3.5 years. Around
Mm.
between 3 to 4 years in the middle, just 3.5 years.
3.5 years. Okay, yeah. So please, your children between 2 and 5, 2 and 7, stomach swollen or blood in their urine, please, they have to go to the hospital and let the doctor examine them. So, and in terms of the diagnosis, how do doctors confirm Wilms tumor in this age group after the parents have come to the hospital?
Normally, when the child is presented by the parents at the hospital, they do a scan. Once the
Yeah.
scan indicates that there's a tumor going on in the kidney, the immediate thing for the doctor will request is for a surgery to be done. Is the outcome of the surgery the tumor that the kidney and the lesion that is removed that will be taken to the lab. In the lab, it will be divided into pieces, put under the microscope. The microscope will look at it and tell us, is it cancer? Is it not cancer?
Okay.
But
So,
the scan would have told us that there's an abnormal growth going on because the way the normal kidney will look under the scan is different from the way the abnormal kidney will look under the scan.
exactly. And I think maybe this is one of those conditions that we can benefit from our parents doing all these unnecessary scans. I always discourage parents from just going to do scans for every little things. But the good thing with Wilms tumor is that it is very easy to diagnose. Just an ordinary scan, we will see that this kidney is bigger or it's growing abnormally, and then we can, it is a very easy condition to diagnose. And like Dr. Lala said, we can now take get a part of it to look under the microscope to confirm it. And in terms of treatment, how is Wilms tumor treated after we've confirmed that definitely something is wrong in the
Well,
kidney?
most of the people that present early, the surgery is good enough. However, some,
Yes.
when they present in the middle of the stages, then they have to have chemotherapy. And some will have to have radiotherapy to the bed where the tumor was removed.
Yeah, so I think what I love about Wilms tumor is that it's one of those common tumor that you can actually cure the child, but the emphasis is on early presentation. So we can actually remove the entire kidney, and
Yes,
hopefully the child will be fine.
actually.
I know some of you will worry that after removing the kidney, how will the child survive? Dr. Lalade, so removing the kidney, what will happen to the child?
Well, every individual can survive on one kidney. So, and the maker of man has been gracious to us to give us two. So when
Mm,
one is affected, I mean, we is sacrificed and the other one suffices. Even in cases where there is involvement of the two, we realize that the diseases do not involve the two kidneys at the same rate. So we can sacrifice the one that is worse and do more or less like a partial surgery or partial cut of the one that is less involved.
mm. Yeah, so luckily for us, we cannot survive on one kidney. But please, that means that that one left kidney is a precious kidney that has to be protected. And this is why we warn against giving all these unnecessary drugs, unnecessary herbal concussion. You never know which child is going to have Wilms tumor, and we need to take out one kidney. So if we have damaged the other one again, then that is almost incompatible with life. So please, our children's kidneys are very precious, and that's why we on ETP warns you against unnecessary herbal drugs and all that. So in terms of, I know the doctors talk about what we call prognosis or rates of survival. So, what would you say is the rate of a survival of a child who has Wilms tumor following treatment?
Well, following treatment, the outcome is still dependent on the stage and presentation. So those
Okay.
that present early, we do another 10, 15, 20 years, no stress. But those that present in late stage 4, they'll be in and out of hospital. They will be having challenges with post-treatment. They'll be moving from when they're treating pain today, tomorrow they're treating low blood level, the next day they're treating cough. The immunity will drop. They'll be treating infection. So many things will be an interplay. But those that present early, once they do their surgery, yes.
They will do well. All right. Thank you. So, Dr. Lele, as we begin to round up, what is there? Is cancer really preventable? Is this something we can prevent? I mean, because that's one question we always like to talk about on ATP prevention. Almost every condition we talk about, we always want to talk about prevention. So, is cancer one of those conditions that is preventable in children?
Well, the prevention of cancer is a bit challenging. However, a limitation of exposure, particularly when a child is in utero, I mean, the limitation of exposure to toxins, to excess alcohol, to cigarettes by the nursing mother will limit the chances of what we call field cancerization and carcinogenesis taking place. So, and also in patients who are not exposed to those toxins and those alcohol and those smoking and cigarettes, their child are likely to have a better immunity at fighting the carcinogens than a child that is born of a mother that is exposed to alcohol, cigarettes, and other toxins and herbs.
Hmm. So you are saying the prevention of cancer actually starts from pregnancy when the mother is pregnant.
Yes.
All right. So after the baby has been born, is there any other thing else we can do, or we just
After the baby has been born, the key to survival is early detection,
okay.
because by that time most of the genes, there are about 2 genes that are indicated in nephroblastoma, I think 1P and 6P or something, and those
Yeah.
genes would have mutated by the time the child is born. So, but if you are observant and you pick it early, I mean, then the child is
Can do.
highly likely to do better.
Okay. So you just brought in a dimension. So are you saying the cancer is genetic? Like there's some genetic?
Absolutely, there's a genetic strain in nephroblastoma. There's a
Mm,
genetic strain in nephroblastoma, and in most of the childhood cancers as well. So you
mm,
realize that some of them, their families, they have a history of childhood cancers in the family,
mm.
or whether there's a risk of their parents would have been exposed to diethylstilbestrol and all that. So so some of them there's a history, or some of them are from Ashkenazi Jews. I mean, the people that marry within their family and all that. So they are prone to having more gene deletions and gene mutations and all that.
Okay, so there's actually some genetic predisposition to cancer, and it can actually run in some families, which is that is also good for us to know. Obviously, some happen like they start with that particular child, not that it has happened before, but it's
Those
also
are the sporadic ones.
sporadic ones. Yes. Okay. And so we've been talking today. I'm happy to have with me a specialist radiation oncologist, Dr. Kehinde Ololade. He has talked to us about childhood cancers and how to the signs and the symptoms of how they can present and how they make the diagnosis and how they treat it. And we have used a very common example of Wilms tumor, which is the most common childhood, what we call solid tumor or abdominal tumor, and how it is being treated. So, Dr. Lale, if you have your final message, what do you want to say to our parents, our listeners, when it comes to cancers in children? What are your key take-home messages for parents? Can you just share with us in one
Thank
or
you
two?
very much. For our parents, I just want to encourage them to be the observance of the children, and also from in pregnancy, they should be mindful of what they expose themselves to, whether the pregnancy is wanted or is not wanted. They should be very, very mindful, because the outcome and the pains that come with the cancer diagnosis could be very challenging. Thank you.
All right. Thank you so much, Dr. Lalide. And thank you for those of you who have listened to us today. If you have any questions on this topic of childhood cancer, please head over to Ask the Pediatrician's Facebook group. You can post your questions there, and I'm sure Dr. Lalide is a member of Ask the Pediatrician Foundation, who will ensure that when he has the time, he will respond to your questions. And if you have somebody, a child who currently is going through this condition, childhood cancer, please don't hide them at home. Take them to the hospital. If it is financial issue, we've mentioned the name of some of these non-profit organizations that can support the child. So if you let us know, we can also give you the link and the contact details so that you can get this right support. But more importantly, we just need to make sure we are very observant. And I think for me, that's the message our specialists have told us. Let's be observant and let's not take everything as malaria fever going for 1 month, child's tummy swelling up, all those, child is looking pale, you don't know, they're not losing blood from anywhere, but they're just looking pale. When we start seeing these symptoms, please and please, let's go to the hospital. And when I say hospital, please go to government hospital, preferably, not a place where they just keep treating us for malaria and typhoid. Let's go to hospital where they do tests so that they can figure out what are the other possible causes of these symptoms, and then they can, because sometimes that is how we're going to pick up a child that has cancer. So my final job today is to thank my brother and our specialist, Dr. Kehinde Olalade. Thank you so much. I know you're very, very busy, very, very busy person politically and elsewise. So for you to give us 1 hour of your time today to do this program, we really want to say thank you. And we hope that when next we call on you, you will respond to us. Thank you.
Thank you very much.
All right. So till next time, when we come again with another important topic, it may be me, it may be myself with another guest. I want to say keep on listening to ATP Hour. Keep on engaging with our professionals and keeping our children safe. And have a wonderful evening. Thank you. And it is bye from us from the studio. Bye.
Pediatricians with Dr. Bami, because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents. Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami, because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.